Of course, in order for the vaccines to improve the course of the coronavirus pandemic, people have to actually get vaccinated. Medical experts believe vaccinations are crucial for gaining control of the dangerous and deadly spread of COVID-19. Even with FDA approval and assurances of safety, many people are skeptical of the vaccines. Gretchen Chapman joins me now. She's a professor of social and decision sciences at Carnegie Mellon University. Dr. Chapman, thank you so much for taking the time. So how much of the general public is skeptical of the coronavirus vaccines this far? And are you concerned by the number? I've seen a recent study that says that 60% of Americans say they would definitely or probably get the vaccine if one were available today, according to Pew Research. Is that enough?
It's not enough. I saw a New York Times article today saying where Dr. Fauci reports that we'll probably need closer to 80 or 85% of people getting vaccinated to achieve community immunity. I've seen some of those same polls too. Kaiser Family Foundation poll shows that 27% of respondents said that they probably or definitely would not get vaccinated. And that's down from 34% a few months ago. So it seems like vaccine confidence is on the rise, but it remains a question whether it will rise enough.
This pandemic is clearly still far from being under control. The death toll continues to rise. When you see this large swath of the population saying that they're skeptical about a vaccine that has, an efficacy rate of 94%, what goes through your mind?
Well, in part, I view it as somewhat understandable for a couple of reasons. First of all, we have other vaccinations that have been available for a long time that don't have high uptake rates. Fewer than 50% of Americans get the flu shot each year. So it's not unheard of for people to fail to take advantage of safe and effective vaccines. And then, of course, the COVID vaccines are brand new. So it might be understandable for people to be a bit skeptical about the speed of development and the fact that although they have been tested in tens of thousands of people in clinical trials, we don't have that track record of years and years giving it to millions of people and seeing low or no adverse events.
So what exactly are people hearing about these vaccines? We know there's a lot of misinformation out there that is making them hesitant about getting vaccinated.
I think the biggest message I would want to give about that is that vaccine hesitancy is not just about facts. Of course, it's important to present transparent information about the safety and efficacy of vaccines. But that kind of information is only part of what drives our attitudes and confidence. Social factors are a huge determinant of behavior. We tend to want to do what other people like us are doing. And that's why I've been very happy to see politicians and celebrities and other prominent people making public their vaccination. I think that tends to normalize the process of vaccination. And as we go forward with the vaccine delivery process, each of us is going to start to know other people who have been vaccinated. And it may be that creates a sort of social norm of seeing what other people are doing that's going to make each of us more comfortable with it.
You mentioned some of those politicians getting vaccinated. Well, those are also some of the politicians that were telling Americans to cast aside concerns about COVID-19. How much influence do medical experts like Dr. Anthony Fauci have on people's trust in the vaccines? And what about the president and other politicians?
Medical experts are one of the most trusted groups in America, and getting a recommendation from a physician to get vaccinated is strongly associated with vaccination behavior. In fact, we even know something about the ideal way to deliver a recommendation. So I think those medical experts are very important. The politicization of behaviors to combat the COVID pandemic has been unfortunate. We saw that with masking behavior, that there's a big divide between Democrats versus Republicans in their willingness to wear masks. And I think that erodes trust in the information that politicians are giving, because the public may view now vaccination as, again, politicized and there for political gain rather than for public health. So a unified, accurate message from all levels of government is really important in building trust and vaccine confidence.
That PR campaign is so essential. And to your point, Dr. Anthony Fauci has received death threats. He has to have personal security, and he's, a leading health expert, not a politician. What should be done to improve Americans' confidence in the vaccines?
Well, psychological research indicates that vaccination behavior can be facilitated if we make vaccination the easy course of action. So, in addition to trying to change people's beliefs and attitudes about vaccination, we can also structure the environment so that vaccination is the easy thing to do. So that means making the vaccine free, very convenient to get, things like pre-scheduled appointments, so a person doesn't have to make an appointment themselves, the vaccine available at pharmacies that are open 24/7, those sorts of things. And in some cases, we may actually want to offer some kind of incentive or inducement to get vaccinated, like a fun sticker or bracelet or something that you get to show that you've been vaccinated.
Dr. Chapman, do you think that there has been too much damage done to public trust in the name of science so far when it comes to this COVID-19 vaccine and getting people to participate?
I do think trust has been damaged. I also think that the large majority of Americans are going to be willing to be vaccinated, and we need to employ behavioral science to try to bring along that remaining numbers of the public who remain hesitant.
Gretchen Chapman, thank you so much for your insight. We appreciate you being with us on a Sunday.
Thank you so much for having me.